Tonight, inside a Granite City hospital where the caregivers have become the casualties. Paychecks that failed twice in July, health covers that lapsed while premiums came out of their checks, and medicine cabinets running thin. The hospital's owners promised the state a different story. Our political editor, Mark Maxwell, is investigating the financial pressures impacting patients and workers at Gateway Regional Medical Center.
And Steve, the alarming phone call came in this evening from inside Gateway Regional from a worker. We've verified her employment status, but we've agreed not to name her because in Granite City right now, speaking out and getting paid feel like competing interests. What she describes is a hospital being held together by the people it keeps failing. Inside this Granite City hospital, workers tell us the shelves are running bare.
They haven't been paying our medication supplier regularly, so we go on hold. So we run low on medications. You can't run a hospital without medications.
And they can't stock their own cabinets at home without steady wages. Twice this summer, paper checks came in place of direct deposits, along with fears the checks might bounce. Some did. Then she says workers discovered the deductions leaving their checks for health insurance weren't actually buying health insurance.
We were paying out of our paychecks the premiums, but the ownership was not paying their part of it, so we were losing coverage.
We put every one of these accounts to the owner, Mike Sarians, the CEO and the company's chief legal officer, Monday afternoon in writing. To their credit, they responded, saying the Sarians' personal $1 million loan was funded August 1st and that every payroll since then has run normally and on schedule. Their response did not address the insurance lapses, the medication supply, or whether the hospital is solvent, the question at the center of it all.
The ownership needs to speak to the financial solvency of that hospital.
The parent company is American Healthcare Systems of Glendale, California. Its St. Louis connection shows up in public records. Seeking Illinois' approval to buy Gateway, the company cited as its background its management of South City Hospital, a facility already deep in financial collapse under prior ownership. Gateway's workers got a first-hand account when some of South City's people ended up working beside them.
We were watching it happen, and we did get employees from that hospital when it closed. The same kinds of things that we're running into now.
To buy Gateway, the company filed a certified application with the state of Illinois in December 2022, promising there is no present intention to reduce the scope of services. The company said it anticipates retaining existing quality programs. The application came gift-wrapped with letters from 5 state lawmakers and a county chairman who assured regulators the company has a record of acquiring and managing underperforming hospitals and of increasing healthcare services while preserving existing staff. That has been its history. Illinois approved that sale January 24th. South City closed August 3rd, 191 days later.
I'm not going to stop until we get the answers.
The company will answer the Congresswoman in writing and has invited her to visit. Inside the hospital, the workers tell us some nurses and staff have already walked off the job over the paychecks and haven't come back. Their patients and their workload now belong to the ones who stayed.
We're still moving up and we're still taking care of our patients. It definitely feels like everything else is just kind of falling apart around us.
We've also asked Governor J.B. Pritzker's office what he'll do. We've also asked the health department and the review board what they knew and when. The company says it has resumed direct deposit and offered its workers assurances, but those assurances are coming from a company running something of a deficit in the trust department.